it's just like, gosh, where I was, I would not have been able to play with her. And she's just an important part of my life. Here you go.
Marianne Galang can run around with her granddaughter thanks to a new type of back surgery she received at Cleveland Clinic.
There were so many things I was not able to do, and just was very frustrated with that. I was missing out on a lot of activity. I've always been an active person. I liked weightlifting. I liked being on the treadmill or the elliptical machine. I could not do that anymore. I couldn't stand long at events. And once I was on the medication, I thought I was doing okay, but I think I was a lot more depressed than I realized until after everything was said and done. Before the surgery, I would walk like 10 feet and my back would start to hurt and my legs would be numb and painful. So I would have to stop and kind of realign. I had spinal stenosis and spondylolisthesis. So it means the vertebra was starting to shift, which pinches the nerve even more. And then the canal was narrowing, so it was pinching on the nerves as well.
After trying injections, medication, and physical therapy, Galang was anxious to try surgery.
The TOPS is a new device that's available for the spine.
Dr. Michael Steinmetz is director of Cleveland Clinic's Center for Spine Health.
These devices provide stability, so to say, where it's needed in conditions such as spondylolisthesis and stenosis, but still allows motion elsewhere. And what that is specifically, it's a patient that presents with the neurological condition stenosis or neurogenic claudication that's due to narrowing around the nerves in the low back. Typically it causes pain, numbness and tingling in the legs, difficulty walking, so they can't walk for a long distance because their legs hurt, they get weak, they get tired, or they get numb. But with spondylolisthesis, one bone has shifted forward on the other bone, typically L4 and L5 in the lumbar spine, and that's due to arthritis. It's not a traumatic instability, but one shifts forward.
Recovery time is 6 to 8 weeks.
The recovery was fine. I was, short bits of activity and progressed along, worked with physical therapy along the way. And that got better and better. And then the first time, I was able to, a few months later when I got the AOK, to start working out a little bit more and able to get on the elliptical. And I was like, oh my gosh, I did 30 minutes pain-free. It was just like so exciting. And just to walk and be off the medications, I just felt like revived, totally revived. So I'm enjoying running and playing with my granddaughter and just being goofy that way, and I can walk the dogs for a long period of time, and I can get on the elliptical for 45 to 60 minutes and lift weights, and so I just feel like everything is so much better.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.